With more on this escalating crisis, I'm joined by Dr. Nahreen Ahmed, the medical director of MedGlobal, an international medical organization that supports vulnerable communities. She just returned from the Egyptian side of the Rafah border crossing last week. Dr. Ahmed, thank you for being with us. This is a uniquely difficult one for hospitals, for medical organizations like yours who go into these parts of the world just to help the afflicted. And you're sort of finding yourself in arguments with government officials who say what you're saying and what your doctors are seeing is not the truth.
Yeah, I mean, to speak and be able to speak for our staff and the healthcare workers that we're advocating for is one of the most important responsibilities that we have right now. Not only that, but to also advocate for the safety of our patients. These are staff that we are in touch with on a daily basis. We believe what they are telling us, and we need the world to know that. And just yesterday, our staff, when we were able to contact them earlier in the day, we could hear the bombing in the background. We could hear the destruction in the background. And that is very real. That is a direct conversation that we are having with our staff. We believe what is happening. We need the world to know, and we need there to be a safe way to evacuate them.
So let's just discuss this, because when you look at the images and you hear the competing statements that are put out there about what's happening, the end result is some sense of chaos. What can you tell us about what's surrounding these major hospitals like Al-Shifa, where you've got people like the Nasser Hospital? What's the problem? What's the issue right now?
So, I mean, the main issue is that, our staff and everybody at Al-Shifa Hospital were told that when this pause happens, that you can safely leave the hospital and exit to go towards the south of Gaza. The concerning part that happened yesterday was that we had advised our staff, we had advised them, if there's a safe window and that's being announced, then you should move to the south. However, in an attempt to do so, they witnessed 5 people getting shot on their way to exit the hospital, and they were not able to retrieve the bodies. 4 injured people who were also shot on their way out were brought back into the hospital. They witnessed that. They were unable to leave. That is the problem. That is what I'm focusing on. And what we as an organization are focusing on is that they witnessed that, they are realizing that it's unsafe to leave, and they are trapped there. On top of which, the patients that are suffering at Al-Shifa because of the fact that resources cannot get there is a whole nother issue as well. So it's not just that the civilians and staff are unable to leave, but they aren't able to evacuate patients to a safe place and in a safe way.
And then there's this ongoing discussion, because when we speak to Israeli authorities about this, their response is that these hospitals, these medical centers are, staging areas or military operations. And we've got doctors saying that's not the case. This is obviously a very difficult situation for organizations like yours, because, again, your mission is to treat people. But there's that back and forth going on.
Yeah, I'm here to talk about the fact that we need to depoliticize human suffering. I'm here to advocate for the patients that are in need, and I'm here to advocate for my healthcare colleagues that are unsafe. That's the most that I can say, because that's the truth that we're hearing, that they're unsafe, that they're unable to perform their duties, and that's what we're here to talk about.
How do you get the health care, and I don't mean you specifically, but how do we get the health care necessary to those people who are suffering in Gaza? Is there enough? Are there enough supplies coming in? With the bombing of hospitals, I know some neighboring governments are talking about setting up field hospitals in Gaza. What in your opinion and your estimation, is the best way to continue to help more and more people who are getting injured every day?
Yeah, I mean, first of all, let's talk about the supplies. As of yesterday, only about 53 trucks had made it across the border, and that's a combination of medical supplies, water, and food. And on a daily basis, pre-escalation, there were almost 500 trucks, and that was outside of the massive amount of injuries that are being seen in hospitals. So imagining that and those numbers, just to put it into context, there are not nearly enough medical supplies. And as we know, there isn't a safe corridor to get those supplies to where they're needed most, which is in some of the hospitals in the north of Gaza and Gaza City. And so being unable to do that, if you have supplies sitting at the border and they're unable to get to where they're needed, then they might as well not be there, because they're not being able to be put to use. And that particular issue needs to be addressed. Hospitals in the north are telling us they've run out of fuel, and that patients are dying, as you mentioned, 5 ICU patients and 3 babies on incubators that we know of. And given that we've lost contact, I'm sure that there is more. Between trauma injury and chronic disease and diarrheal disease and respiratory infections that are now emerging from the crowded conditions that people are living in. There's not nearly enough to support the people of Gaza.
Dr. Ahmed, thank you for the work that you and your organization are doing. Dr. Nahreen Ahmed is a medical director at MedGlobal.